So the early adverse effects of lithium, GI distress, which pretty much any oral medication seems like it causes GI distress, doesn't it? But remember, they feel tired. Now you start thinking about you're messing with electrolytes. These other side effects will make sense. That's the best way to remember these things. Don't just try and memorize a list. What you want to do is group like things together. We call that chunking information. It will help your brain remember. So I know that lithium is in the same periodic group as like sodium and potassium. When you start messing around with my electrolytes, muscle weakness makes sense. Headache makes sense. Confusion makes sense. Memory impairment and polyuria and thirst. Whoa, this is a big bummer with lithium. When patients start taking lithium, they start peeing like crazy. Poly, meaning many, urea, a lot of urination. They pee a lot. And because they pee a lot, they're very thirsty because their body is saying, what the heck is going on? Everything we're taking in is going right out. Now, hopefully that effect will wear off. These are the things that happen early on when you're taking lithium, and most of this should kind of go away. But initially you can see, would you be excited about taking a medication that causes all of these side effects? Yeah, most of us, the answer would be, thanks, I'm good. But remember, it's a mood stabilizer. So we're treating someone who has some severe highs and severe lows and impulsive behaviors. So while this will take some encouragement for the patient, you want to recognize this is normal that they experience these things early on in the treatment. Now, fluid balance and lithium. Remember, lithium causes you to have that polyuria. You pee out a lot. Did you kind of wonder why? Well, oftentimes if you understand the why behind a side effect, it'll just stick better in your brain. I love the picture that we put here. This is usually what you see on a water closet sign. Lithium blocks the effects of a hormone, ADH. Now, take a minute and write out what ADH stands for. A is anti, D is diuretic, H stands for hormone. Okay, so what this hormone does, remember, hormones are just chemical messengers that tell my body what to do. Anti is clearly against, diuretic is peeing out water, and H stands for hormone, which just means chemical messenger. So this is a hormone that tells my body to be against diuresing. Lithium blocks that effect. That is why a patient on lithium pees out a lot, okay? Because lithium blocks the effects of anti-diuretic hormone. Okay, so you've got this excessive urination going, I mean like up to 3 liters a day. Hey, average would be like you take in about 1.5 liters of fluid and you put out about 1.5 liters of fluid. This is gonna be twice as much caused by the lithium. Why? Remember, lithium blocks that hormone, anti-diuretic hormone, which is why they pee out so much. So this puts a patient at risk to be a little bit hypovolemic. If I'm excessively peeing out fluid, my intravascular volume is going to drop because I just have less volume on board. This puts me at risk for orthostatic hypotension, makes me kind of dizzy sometimes. If it gets severe, it could put me into hypovolemic shock. At the very least, it's probably going to drop my blood pressure. So you want the patient to increase their fluids to try to deal with that. Okay, so we walk through why lithium makes a patient pee so much. It blocks ADH, they have excessive urination, and it's your job to educate them, not only to keep a normal sodium, but to also increase their fluids to help keep a balance. Now, oftentimes, patients who need lithium are going to have to be on it for life. So there's some chronic adverse effects. We talked about what happened early on in lithium treatment. Now we'll look at the potential for things to happen if a patient is on this for a long period of time. First of all, it might cause degenerative changes to the kidney. So you're going to want to monitor kidney function consistently over a period of time, and especially during acute hospitalizations. Also, as a nurse, you want to make sure that you're not administering a medication that also is damaging to the kidney, like say possibly an antibiotic. So your job is to be on the lookout for this patient's kidney function if you know they've been on lithium. The second organ it might affect is the thyroid. Now it could cause a goiter, that's just a big enlargement of the thyroid, or it can cause hypothyroidism. If it causes hypothyroidism, we might need to replace that thyroid hormone with levothyroxine. So your job as a nurse is to know that a patient who's been on long-term lithium, you want to look at kidney function and you want to pay attention to what's going on with their thyroid. Now, lithium interacts with some medications. What about diuretics? See if you can remember why a diuretic might be a problem for lithium. Remember, diuretics cause low sodium. Low sodium for any reason puts a patient on lithium at increased risk for toxicity. Good job. Now let's look at NSAIDs. This one you may not be familiar with. NSAIDs suppress prostaglandin and have increased retention of sodium and the lithium, okay? So a patient who's taking lithium can't take an NSAID like Aleve or ibuprofen, naproxen sodium, those simple over-the-counter medications, because NSAIDs plus lithium will increase their risk for lithium toxicity. Now, antihistamines, this one is a little problematic because antihistamines cause urinary retention. So we know that lithium blocks ADH when you pee a lot. If you had taken antihistamine that causes urinary retention, this might be particularly uncomfortable for your patients. So when you think about interactions, you want to watch your patient closely for low sodium if they're taking diuretics. They cannot take NSAIDs and lithium at the same time because it puts them at a risk for lithium toxicity. And antihistamines might make your patient really uncomfortable because of the risk of urinary retention.